Well, Brian, you know, a lot of people are asking that question. What do you do if you cannot get on the exchange and buy insurance and your employer does not provide insurance for you and you have to go out and buy your own? Well, as you know, the president made an emphatic statement repeatedly, and he did so in order to help him pass this legislation, that if you liked your current insurance policy, that you would be able to keep it. We now know that that is simply not true. The president made those statements because it made it easier for him to pass his legislation. I might also add that on this legislation that affects every aspect of health care in America, when the bill came to the floor, Nancy Pelosi was the speaker. She adopted a rule that would not allow one member of Congress to offer one amendment to that 2,500 page bill. So we could not change one, we could not attempt to change one period, one comma, one semicolon, or one sentence. It was all take it as it is or not, and since she controlled the House, they passed that legislation. So what's going to happen is individuals are going to have to go on the exchange because many of them are going to lose their insurance. They're going to have to go through the process, try to compare insurance policies, and preliminarily what we're finding out is that the premiums are going to be higher, the deductibles are going to be higher, the copays are going to be higher, and in many instances the person's not going to be able to get the coverage that they need. Now the sad thing is it's going to depend upon every individual to make those decisions for themselves, and we really are not going to know the complete consequences of this bill until about the year 2016, because the president did not want to have to face the wrath of the American people very early, certainly not before his first election. So most of this bill does not take effect until he's leaving the White House. So Fred Upton, the chairman of the Energy and Commerce Committee, has introduced a bill with a lot of Democratic support and Republican support that will be on the House floor, I believe, this week, that will grant individuals an additional year to keep the insurance they have now before they have to go on the exchange. We think that is a reasonable thing to do since the president has been granting a lot of waivers to interest groups that he supports, but he's not willing at this point to do it for individuals that are faced with this very important issue for them and their family.